I'm Dr. Mike Milligan. We're here at the Chicago Midwinter Dental Meeting, and I've got a real treat for you, Dr. Mark Montgomery. I'm sure you've heard of Mark. He's been all over the educational scene. Mark, thanks so much for being with us.
Thank you, Mike. It's glad to be here.
Now, Mark, briefly your history. You were with PAC Live from the beginning. You've done a number of things. Tell us a little bit about your history, and then we're going to get into TruDenta, which is what you're doing now.
Sure. So I started practicing in 1980 and focused my practice for 30 years basically on comprehensive dentistry, TMD, pain, ortho, and was fortunate enough to be able to start with PAC Live at the early days of the aesthetic revolution. And so we did live patient hands-on courses. We brought doctors from all over the country and trained them in veneers and restorative and all that. And I also was fortunate enough to be with Invisalign from the early days and did a lot of lecturing and training for Invisalign and their systems. And over the years, the things that have been most interesting to me are putting together systems that doctors can use day in and day out that make their practice better, that get their patients better. So,
right, and Mark's from Salem, Oregon.
Yep.
And so now you put together TruDenta. You're the clinical director. What's your title?
Yeah, I guess my title is Chief Dental Officer or
Chief
something.
Dental Officer, okay. Tell us about TruDenta. It's a fabulous system. Give us the brief overview and then we'll get into the details.
Yeah, so TruDenta has developed to be a system to treat headaches and migraines and all kinds of dental force related problems. And there's a huge population of patients who are not getting treated for headaches right now. In fact, most of us on our dental histories, we say, do you have headaches? And the patients say yes, and we go, oh, so I see you have headaches, good, okay, and then we move on to the teeth. And so, but these patients really, not only do they have the headache pain, and for those of us who don't have headache pain, we don't really get it.
Yeah,
but
exactly.
These patients who have chronic daily headaches, sometimes more than 15 days a month of headaches, or 3 or 4 migraines a month that last 3 or 4 days.
Yeah, it's debilitating.
And it's not just the pain. It goes into the brain chemistry, it makes them depressed, it makes them more like a chronic pain patient. They don't sleep very well, and these patients live their life with several key emotions every day, and those emotions are exhaustion, frustration, anger, and guilt. And it's horrible to live a life where you're just trying to cope with headaches and pain all the time.
Absolutely, and there are a lot of people that this system would benefit from. You look at Google searches for TMJ or pain patients, and it's multiple times of the Google searches for veneers or cosmetics or something like that.
Right, right.
So this is a system that allows the dentist to, I'm understanding, 95% success rate?
Well, we are seeing amazing success rates with headache patients, and the reason for that is that all headaches travel through the trigeminal system.
Right.
That doesn't mean that the teeth cause all the headaches.
Yeah.
But it does mean that the area that we treat every day is the focal point for headaches. And if we can influence normal function or dysfunction or parafunction in that region, we can get these patients better.
Yeah, absolutely. So the dentist is the perfect person to treat this. In fact, your staff does about 80% of it.
Yeah. So our system is set up in a way where it's basically a physical rehabilitation model.
Okay.
Most of these headache patients have been injured. They've had car accidents or sports injuries or taken an elbow, playing basketball or falling off their bike or their skateboard. These people have all been injured. Sometimes it's just iatrogenic dental stuff. They had an oral surgery done, they got trismus afterwards, and then we just kind of watch and wait. So in the medical world, if you injure a limb, like your elbow or your knee or your ankle, you don't wait.
Yeah.
You treat it and you get rid of the inflammation, you get rid of the dysfunction, and you rehabilitate that back to normal.
Yeah.
But evidently the head and neck is not that important because we just watch and wait, see what happens. And what we found out is a year after the injuries are when the headaches start. And so the patients really don't always correlate the headache or the face pain with that injury, but with a good history we find this out. And the research is showing that when you can go back and rehabilitate these old injuries, you can help get rid of this chronic pain and headaches.
So tell us about the system here. You've got some hardware and the phenomenal training.
Yeah, so
put it all together.
Yeah, the essence of the system is that we have developed a assessment system and a treatment system for people that have these types of problems. And the key elements of the assessment system are, how do you know whether your patient is functioning normally or if your patient has dysfunction? And so we have a protocol and a system for that, and equipment and software. We evaluate forces in the mouth. We evaluate the range of motion of the patient, both cervically and mandibularly. And we take a look at, some of the normal things that we would think about, muscle palpation and all of those things. And then out of that assessment comes a review of findings and a treatment protocol that then allows the patient to know exactly what kind of treatment they're going to get. So the system really is an assessment system first, and then a treatment system that flows out of that.
The assessment, the examination is a time frame for that. You're looking at about an hour exam or
well, probably about an hour for the patient. However, the vast majority of that is done by your auxiliaries in a way that allows you to get the data and then just confirm that with your history and your physical and move forward.
Okay, so you've got an hour for your diagnosis and examination diagnosis. And then tell us a little bit about what we do with the system.
So then with the system, really there are four main components of treating these problems.
And you grade them into levels 1, 2, 3, and 4. Basically, the patients.
Yeah, out of your assessment, we have some patients who have low-level problems, and then we have patients who have end-stage problems. And so we have different protocols depending on what it is. But each of those protocols incorporates four elements.
Okay, now we're talking.
Those four elements are in-office rehabilitation therapy. And so we have designed protocols and systems for bringing physical therapy procedures in-house that can be performed by the dental auxiliaries under the supervision of the dentist. And these physical therapy protocols then are what allow the patient to start to get well. And it's just like if you went to physical therapy for your knee or whatever. But that's done in-house in the dental office. The second piece of the puzzle is that we've provided patients a very clear and concise home care system so that they can do their exercises, manage their pain, manage their sleep, manage their stress at home so that they can take control of their pain. I mean, certainly if you have pain, one of the best gifts you can give a patient is the control. Because if you can't control your pain, you are in a hopeless situation. So we really are happy to provide them with this home care system. The third element is that we have a system of dental orthotics, and the orthotics are designed specifically to match the treatment protocol, which matches the assessment. And so then we use these specially designed customized orthotics for our patients, and that provides the environment, the symmetrical environment for the rehabilitation of the muscles and the joints back to normal.
Put them in the right positions.
And then the fourth piece of the puzzle is probably what you would expect, that as you get the muscles and joints and the pain rehabilitated, that these patients get more normal in their posture, more normal in their movements, and now we uncover these dental force imbalances, and it's time for us then to help our patients balance these forces in a way so that the feedback system, the proprioceptive feedback system, is normalized, which tells the brain that it's okay to not be in pain anymore.
So your bite balancing, your equilibration is what you're talking about there.
Yeah, minor conservative force balancing the occlusion. And then after a patient gets out of pain, goes through their TruDenta process, a lot of times these patients end up being ready to receive dental care. And they may have dentistry that needs to be done, and then that assessment comes at the end of their rehabilitation.
Okay, so then the dental treatment on top of the pain treatment.
And I'm sure that this has been true for all of us, that patients who are in pain, they don't want to get dental treatment done. They don't want to. Some of them, I've had patients who don't even want to sit in the chair for an hour to get their teeth cleaned because they get migraines.
Absolutely.
So So they'll often say, can I divide my appointment up into two? And and those types of responses, or they just don't show.
Yeah.
They'll make the appointment, they know they should do it, they know they want to do it, but they've got a headache, and then they just don't show. So
now, TruDenta helps you with your marketing as well, in a big way.
Well, one of the things that was real important to me as we designed TruDenta was that it wasn't just continuing education, that it was actually a system where you could assess the patient, treat the patient, market the care you provide, and provide the logistical support that you need inside your practice as well. So we work with the whole team. Probably 80% of the TruDenta treatment is done by the auxiliaries, by the team, and about 20% by the dentist. But then we have partnerships and relationships that can support the new way that this dentist is providing care to make sure that their branding, their marketing, their niche, their identity is available to the public so that they know these patients are there. So we have
marketing's been highly successful, and your treatment, I think we mentioned, is in the 95% success range for these patients who need it. And the dentist is the perfect person to do this.
So I think that sometimes when we say that we have a high percentage success rate like that, sometimes there's like, really, that sounds too good to be true. But when we think about how we've treated these problems before, it's not too surprising, because usually the way we treat them is, well, we'll try a splint, or we'll try a night guard, and then we'll have the patient come back. So how do you feel? Yeah. And so it's all symptom-driven, trial and error treatment that never really rehabilitates the system. Yeah. But since we have a start-to-finish, step-by-step process, then it allows the dentist and the patient to go right through that process, and they know what result they're going to get. And it's correlated with an assessment. So we have objective findings at the beginning. We expect to improve those objective findings over the course of treatment.
Right.
Yeah.
Now, can you take just a minute and tell us a little bit about the hardware that you use in your system?
Sure, absolutely. Okay. So from an assessment standpoint, the two pieces of the puzzle that are most interesting probably are the T-scan driven scans of the forces on the bite. And those forces, originally when we started using T-scan, we thought it was just an electronic articulating paper. Well, now with the most recent research, we realize that the T-scan itself, that the scans we do, actually tell us what's happening with the musculature. So we can tell from our scans whether or not there's limitations of movement in one of the sternocleidomastoid muscles, or if there's limitations in one of the temporalis muscles.
Okay.
So we're getting much more diagnostic information out of the T-scan than we ever thought possible. Okay. So it's not just electronic articulating paper anymore. Okay. It's truly a functional scan of the patient. And then we have software that we call the TruDenta ROM, which is a cervical range of motion software that allows us to measure at the beginning the limitations that these patients have dysfunctionally cervically in the C1, 2, 3 area.
Okay. Good.
And the reason for that is that those muscles are all compensatory muscles with the muscles of mastication, and they're all driven by cranial nerves that travel in the same column as the trigeminal system.
Right.
So since it's all part of one system that talks to each other, we must use this information to help us get better.
Okay.
And just like if you had a sciatic nerve problem in your leg, you have to reestablish normal range of motion in your leg in order for that pain to get better. But with the head and neck, we need to get cervical range of motion improved in order to get rid of headache pain.
Makes sense.
So then in addition to that, we have, on the treatment side, we use 3 pieces of equipment primarily that are well documented in most physical therapy processes and in a lot of the occlusion textbooks like Okeson and others. And that is, we have an ultrasound unit that helps us break up scar tissue and deep adhesions and stimulate blood flow. And we use a microcurrent, which is similar to TENS, only it's a micro TENS unit that is used sub-threshold, that actually decreases inflammation, increases ATP in the muscles, and allows for normal nerve firing of the system. So we're kind of resetting the neurology as we get the muscles to loosen up and get back to normal. Yeah. Then the third piece, which is probably one of the most exciting things, is that we have this cold laser, which is a low-level laser therapy. And this low-level laser therapy is well known in elite sports medicine and all of that to reduce pain and inflammation and to help us reset the neurology of muscles. So we can use we use all of these in combination at very specific settings, at very specific times, very specific protocols, so that it's not a guessing game for the dentist. It's not.
Now, isn't one of your partners, didn't he get the FDA approval on that?
Exactly, exactly.
So.
Dr. Rick Amy was the first clinician in the United States to get FDA approval for the use of low-level laser therapy, which means clinical studies and, how do you measure the results of that? And, the FDA is pretty picky about that. So we know that we're using this machine, this equipment, exactly the way that it was intended and that we can get the results that we expect.
And then you've got a lot of training and support. Before you even go for the 3-day training, you have a lot of information that you provide online for the purchaser of the system.
We have tried, as we've built our system, we've built reference materials. So we have reference books that you can have either hard copy or we have electronic iBooks. We also have online videos of each of the steps of the procedures, and this is all available in a library for the doctors. We have a website that includes literature references, so the doctors can go on and research the latest in the foundations of our system, and then they can gradually get trained up in each of the pieces of equipment, learn the assessment tools, learn the treatment tools, all in distance learning from the comfort of your own office, and within staff meetings, which are coached over the phone or on the web as webinars or direct coaching training. And then once the team has had the full system ready to go in their practice, then we bring them to a 3-day workshop that really is a clinical skills workshop, and we lock down all the calibration of all the things you need to do to make sure that your office is ready to go.
And then follow-up training as well. So, and support, total support for the system. And then, how do we get a hold of you?
Well,
what's your website?
Well, the best way to get a hold of us is at TruDenta.com and or at drsdoctor.com.
DRSdoctor.
And through either of those websites, you will be able to log in and get access to many testimonials from patients and doctors who've implemented this in their practice and patients who've gotten better. It really is pretty amazing to see the results that have been achieved through that. And then, in addition to that, if you're interested and curious about how this all works, we also do some free TruDenta webinars. So you could come on and participate in one of our webinars that we have, and those dates are all available on the websites as well. So,
Mark, thank you so much for all that information, for developing the system, and for being with us here today.
Thank you so much, Mike.
Okay.
All right.